Good morning and happy Sabbath, church family. Thank you for joining us for another health nugget. My name is Dr. Jude Pear, and I'm here with Dr. Lenward McCalla. And today we're going to provide some education that will hopefully have us all turning a new leaf when it comes to leafy greens. So let us begin by taking a closer look at lettuce. Now, the best place to start would be to talk about the various types of lettuce that there are and what their benefits are. Now, just like there are similarities between different members of a family, the same will reign true for lettuce. So you'll see some benefits are repeated, but the thing to keep in mind is to figure out which benefit you're trying to achieve for your diet and which leafy green will help you achieve that. So Dr. McCalla, could you help us and talk to us about the first leafy green?
Okay, our first green that we're going to discuss is arugula. And it has anti-cancer properties. It helps to boost our immune system. It strengthens our bone health. It improves brain health, brain function. It prevents neural tube defects in newborns and improves vision health. Butter lettuce.
Butter lettuce, or also called Boston lettuce. It is a great lettuce that promotes healthy eyes, is beneficial for your skin health, increases bone mass, limits damage to your neurons, to the brain. It aids in the production of red blood cells. It regulates your blood pressure. It controls your heart rate. It also has benefits for your lungs and to help you prevent any kinds of cancers as well as oral cavity cancers. And it prevents neural defects in the fetus.
Next, we'll talk about collards. Collard greens, they're very popular in the South here in the United States. Well, what are the benefits of it? It improves bone health. It regulates type 2 diabetes. It improves digestion, promotes healthy hair and skin. It contributes to an improved mood and sleep. It helps to fight cancer, and it improves our overall immune response. Next, he'll talk to us about iceberg lettuce.
Iceberg lettuce. It assists with weight loss, promotes healthy eyes and bones, prevents birth defects as well, enhances blood coagulation, combats depression, benefits the heart, boosts your immune response as well, prevents anemia, supports digestion, and improves sleep.
Next, we have kale. Kale is very popular now. It's become more and more popular. It's good for the hair and the skin. It helps with weight loss. It reduces overall inflammation in the body. It lowers our blood pressure. It improves our bone health. It improves our digestion. It prevents heart disease and prevents vision loss. So kale is, again, another wonderful type of leafy green vegetable to eat. Again, we have another one, Dr. Jude. Which one are you going to discuss next?
Next is red or green leafy lettuce. Now, this one ensures eye health, fights cancer, promotes healthy bones, lowers your risk for restless leg syndrome and gout, reduces mental and emotional disorders, prevents heart disease, and helps treat anemia.
Okay, next we have romaine lettuce. Now, romaine lettuce is the most popular type of leafy green that we eat here in the United States. And so let's talk about the benefits. It provides antioxidants for us. It boosts our heart health. It prevents bone loss. It promotes healthy eyes and healthy skin. It also boosts our overall immunity. It helps us to fight cancer. It helps us to maintain a healthy pregnancy for the women who are pregnant and eat it, and it aids in digestion. Talk to us about spinach.
Spinach is a really great leafy green. This one helps with maintaining bone health, prevents constipation, fights infections, great for eyesight as well, helps with weight loss, relieves stress, has anti-aging properties, is good for the formation of blood, is effective food for pregnancy, and is beneficial for high blood pressure. And this one is especially good when cooked because that helps your body to absorb the nutrients a little bit better.
Excellent. Now, next I have Swiss chard. Swiss chard aids in controlling diabetes. It aids, again, in bone health. It enhances brain function, enhances the quality of our blood. It aids in our blood pressure and our heart health. It helps with the retinal function. It promotes healthy hair. Now, we've learned about all the benefits of lettuce, but is lettuce safe to eat? Why is it recalled so often? Talk to us about that.
Well, lettuce is safe to eat. It's something that we eat raw, so that would prevent us from kind of killing the different bacteria that could contaminate it. So they recall lettuce, even though the FDA tests it frequently, just like all the other food that we consume. Sometimes they'll miss different contaminants because the lettuce can be contaminated through maybe birds that fly overhead and may defecate on the crops or near the crops. Also, the water can be contaminated that waters the crops because of cattle that may be grazing nearby the water supply. So it's very different, many different vectors that could actually contaminate the crops. So the main thing that we should keep in mind is the E. coli bacteria, because that is within feces. So talk to us a little bit about that and the statistics on that.
Okay, there was a study done in 2017. They kept the statistics of the number of infections reported from foodborne illnesses. And we're going to look at 4 of the worst ones. The first one is E. coli. E. coli is a bacteria that comes from our intestine, or intestine of an animal like a cow or so forth. And E. coli, 48% of those infections in 2017 were a result of raw vegetables. 48%. 26% were a result of beef. Now, you would think that would be flipped, that beef would be more likely to infect you, but actually it's the raw vegetables. 14% are other foods, 7% is dairy, and 5% is fruit. And next, he'll talk to us about salmonella then, Jude.
Yes, salmonella. This one is, the raw vegetables are very low in transmitting this foodborne infection. It's only 5% as of 2017. Chicken was 14%. The majority is other foods, which was 52%. Seeded vegetables was 17%, and fruits were 12%. So talk to us a little bit about listeria and how.
Okay, listeria. Again, raw vegetables are not as high. They show up as 11% of the infections of listeria. 13% chicken. 6% sprouts. But the largest contributor to listeria infections is actually dairy, 44%. And then fruit, 26%. So between dairy and fruit, that's a very large percentage. Talk to us about Campylobacter.
Campylobacter also has a very small transmission rate through raw vegetables at only 4%. Chicken is the majority with 48%. Other foods, 23%. Seafood, 15%. And turkey at 10%. So raw foods seem to be just the most likely to transmit E. coli. So that's our main danger when it comes to our green leafy greens.
Leafy greens, therefore, are potentially a very risky food for us to eat. When we consider foodborne infections, then what can we do? What can we do to minimize the risk?
Well, we can take different steps. The first would be we can cook the greens until they're a little bit wilted. The heat will act as a way to kill different bacteria that might still remain on the leafy greens. We can also buy the whole head of lettuce, peel out the outer layer and discard that, as that would be most likely to be contaminated by the environment. Also, we can keep packaged lettuce cool and eat it soon. So when you buy it from the store, put it in your fridge and eat it soon, within a few days, because then it can start to build out bacteria if you leave it out at room temperature. Also, if you notice that in that bag there are leaves that are wilted or they look slimy or bruised, just don't eat it because it's probably already starting to build up bacteria, which we don't want to introduce to our bodies. Also consider purchasing hydroponic grown greens. Now these are greens that are grown in water, so they're not grown in soil, and they're also grown in a greenhouse. So it has no chance of getting contaminated through the soil, and it's also protected from other environmental factors. Also, you can soak your greens in white vinegar for 10 minutes. This will help to kill other bacteria that for vegetables or fruits that you might not be able to cook. So that's another way of getting rid of those bacteria. And a good thing to remember is that overall, the chances of a food poisoning from your salad is very low. So the benefits outweigh the risk.
That's wonderful news. So don't stop eating your vegetables, but be careful in how you prepare them. Okay. Now, before we finish here, I want to make a plug for a program that's coming up. Today is what you call Made to Move Sabbath. For the whole week from this Sabbath to next Sabbath, the Seventh-day Adventist Church is promoting a healthy lifestyle of exercise. And they actually have a website that you can actually go to and sign up and do exercises and see how much improvement you make in a week. You can get the link from our church site. So if you go on our church site, click on it, and you can go and sign up. I have signed up. I want to participate. I want all the members to participate just to help us all be healthier. It's not only what we eat, it's also exercising. So please participate. And I want to thank Dr. Jude again, once more, Dr. Jude Pear, and this is Dr. Lenward McCalla. Thank you for allowing us to bring you our health nuggets today.
Hello, and welcome to the Made to Move Challenge. We are here to challenge your physical stamina for the next 7 days. And by end of this week, we hope they have grown not just physically, but spiritually also. And during this hard time we're living right now, we hope to motivate you to keep moving forward to the health that God has planned for you.
The North American Division and F5 Challenge have partnered together to bring you a new and exciting workout program. We have 6 workout routines, 1 for each day.
We have prepared instructional videos for you to make sure that you have the proper form and movement. Additionally, devotional thoughts and study guides have been prepared for your encouragement. These will be great group study tools to be done after exercising together.
Remember to be safe, drink plenty of water, warm up, and stretch at the end.
And to prevent injuries, you want to make sure that you know your limits. You don't push yourself too hard. In the time that we're living right now, you want to make sure that you practice good social distancing. So you want to do maybe a virtual online fitness group, and so you can work out safely at home.
Community is important. Make sure to have an accountability partner or partners to encourage each other throughout the week.
And the last thing, make sure to have fun. We're here to support you.
We want to motivate and encourage you to aim high on your fitness goals.
We are all made to move, and we look forward to coming along this fitness journey with you.